Hello, everyone, and welcome back to the Pet Business Pod. I'm Sean Simons, dog owner, pet lover, and member of the Thinker Marketing team. I'm joining Dr. Sami Qureshi here in the booth this week for another informative session. In this episode, we'll be discussing things pet owners can do to keep their furry family members healthy and happy. Thanks for joining us again, Dr. Qureshi.
Thank you, Sean, for the introduction. I'm so excited about this preventative care topic for pet owners. So when we talk about preventative care, we're talking about preventative care with your veterinarian,
Okay.
and preventative care at home.
Okay.
Right?
Sure.
So I'm going to divide that into two areas and see if you have any question around that.
Absolutely. Thank
you. Most of the pet owners think taking their pet once a year or every so often to the vet just for vaccine, or they call it shots,
Right.
which is not true. So preventative care is much broader for us. So let's go over, say, for example, as puppy and kittens, they need to go to their veterinarian for preventative care starting between 6 and 8 weeks of age.
Okay.
So their vet can do a thorough physical examination, making sure they're healthy, weigh them, and then give their first vaccinations, so vaccine for pets, for dogs, are your core vaccines, distemper, parvo, hepatitis, for the initial visit.
Okay.
And then there is, 4 weeks later, there's a second vaccine at 12 weeks of age, 10 to 12 weeks of age, and then also a booster of the first vaccinations. Then at 4 months or 16 weeks, you give rabies vaccine at their final boosters. It's true for cats, but cats don't get the same vaccine what dogs do. But we can go over the preventative for cats in my fourth podcast to go over that a little bit more in detail.
Yeah, absolutely. We will follow up in another episode for preventive care for cats.
Right. Yeah. So these are the visits. So if you get a puppy or kitten,
Right.
6 to 8 weeks, 10 to 12 weeks, and 16 weeks for the vaccines. And then most of us as veterinarian tell you to come back in a year if there's no issues in between for the annual boosters. And then it depends upon the protocol by each vet, and they want you to come in following years for the preventative care.
Okay, so it's important to communicate with your vet closely to get that vaccination schedule.
Correct.
Okay.
Yeah. So I only mention about we call it core vaccine, which are absolutely necessary, and they can be serious consequences if you don't have them done in a timely manner and all that. So, but there are other vaccines beside distemper, parvo, hepatitis, and rabies, which we call it non-core vaccine. What that means is depends upon the lifestyle of the pet.
Okay.
For example, if you are going for cottage, going out in the park, then you should consider also having vaccine against Lyme disease, leptospirosis. These are the bacteria, or these are the bugs. They can get into drinking water from the pond or through ticks. You should consider that. So they're not mandatory for all pet owners. If your pet is strictly in the house and not going to be exposed to ticks and that marshy water where they can get certain diseases, then you shouldn't be having those vaccines done until it's recommended by your veterinarian.
Okay.
So it's a life stage.
For those vaccines then, if you decide 1 year that you were going to go to the cottage, like you said,
Right.
But it's just the 1 year, do you need to keep getting those, like the leptospirosis or the Lyme disease vaccinations, like regularly, or is that something to look at only if you're going on these kind of trips?
No. So once you start your vaccine, you have to have the initial vaccine injection, and then 4 weeks later you have to have a booster. So then the pet will have enough immunity for a year.
Okay.
So far those vaccines are annual. So next year, if you're not going, you don't have to, because they will still have some immunity. But if you're thinking of going the next summer again, then you should have those vaccines updated. The one vaccine I forgot to mention, if you are boarding your pet, somebody's babysitting it, or you're taking the park, or they're going with your friends and they have dogs, then you should have a kennel cough vaccine done. Is a Bordetella vaccine,
Right.
which is a common condition. It can be life-threatening if it's untreated, and it could be just annoying, and the symptoms can be a lot more severe. So the preventative vaccine, there are core vaccine, non-core vaccines, leptospirosis, Lyme disease, kennel cough vaccine. They need to be considered.
Okay. Is that something you would need to check if you're boarding your pet? Some places, would they require you to have certain vaccines?
Yes, they do. Usually the protocol is most of the places, they require once a year.
Okay.
But some places, for example, if you're taking to a pet store type, like PetSmart, I think they have a policy on every 6 months. And it depends, the concentration of the pets they're boarding and everything. Every facility make their own protocol just to prevent. It depends upon the exposure they're going to have. It also depends upon the breeds. Some breeds are more prone to getting that condition who has shorter airways. And so
Okay.
just follow the protocols for individual location where you're going to.
Okay, thanks. It's all about staying informed.
Right.
Other than vaccinations, what other things can you do? I guess on a schedule, going to your vet office for preventative care.
Yes. So for dogs, you're also looking at a parasite control.
Okay.
Because those parasites, there are two type of parasites. One are internal, and they are external parasites. Internal parasites are your hookworm, roundworms, tapeworms. So there are preventative measures you can do every 6 months or once a year. Depends upon, again, the lifestyle of your pet and protocol, what your vet recommends you for your pet's needs. And there are external parasites, which are, there are certain diseases like ticks, fleas.
Right.
So in southwestern Ontario, pet owners usually go in the spring for doing a heartworm test. This is a disease through mosquito bites.
Right.
Maybe in a future episode, we can go over more in detail about that condition. But today, I'm just wanted to mention that definitely testing every year need to be done, because due to the climate change and everything, there are certain type of mosquitoes, and heartworm disease is getting more and more common in this part of southwestern Ontario. So it's a very critical condition, a life-threatening condition if you don't have it tested every year, and if your pet do not go on prevention, that could be life-threatening. Also, a lot of those medications as preventative that your vet gets you after the testing is negative to prevent for the summer is also control the fleas, which is also external parasite on the skin. They are nuisance, they bite, and they can pass on some diseases too.
And they can actually spread to humans, right?
They can bite human, but ticks definitely are the host for Lyme disease in people, deer ticks especially. So you don't know which tick is there if you're out in the woods and everything. So is definitely a zoonotic disease as well if people get Lyme disease from those ticks.
Okay. I do know you mentioned getting tested for heartworm in the spring. That's usually when it's done by a vet. And in the past, I know when I've had dogs, they have said to have the heartworm treatment in the warmer months. But in recent years, because sometimes the warmer months have been lasting longer, or sometimes the winter has been shorter. So I've been hearing from that you should consider getting heartworm medication year round now. Have you heard about that?
Yes. It's still controversial.
Okay.
How much you should get and everything. So I just want to be clear. So when you do the heartworm testing, that's telling you if your pet already has the heartworm disease, positive, antigen positive, or they have the disease. So testing means you are tracking past history.
Okay.
So if you want it negative, because if it's positive, is a treatment, which is a lot more harmful than we are talking about prevention here.
Right.
So if you want, you hope for and pray that your pet is negative for that, and if you're negative, then you can go on prevention, which is most of the time now is a once a month. It depends what product you use, and I don't want to get into that because that's your vet can recommend according to what you choose with them. But I'm giving so the answer to your question is traditionally it has been June 1st till November 1st, 6 months a year.
Right.
But
okay.
you're absolutely right. Past 5 to 10 years, I've noticed that the weather is changing, and people are starting as early as March or April. There's first medication because they see fleas.
Okay.
They already start to see ticks, and they go longer after that. And some clinics are recommending in Ontario 12 months a year or 9 months a year.
Right.
So it all again depends because we are addressing to wider audience.
Mhm.
So I just want to keep it in U.S. It's 12 months a year, no
Yeah.
doubt, in southern states.
Oh yeah, of course.
Yeah. So here in Ontario, you're right, 6 to 9 months,
Mhm.
starting as early as March, April, and going to November. But then everything freezes, so they're dormant and everything. So mosquitoes. If there are no mosquitoes out, you're not going to get heartworm disease,
Okay.
right? So that's what it is.
Okay. Thank you for that information. Now you're mentioning things that we can do between those vet visits in the home to ensure preventative care for our pets. What kind of things do you have in mind when you say preventative care at home?
Yes. So preventative care at home, it includes provide them a safe environment, like if you're taking them out for walks and running with them and everything, you make sure keep the safety in mind. And that's also prevention because some breeds, if you over-exercise them or on the way they pick up something that could be, they get into a foreign object or, in the wood areas, they can get ticks. So you want to make sure that you check your pet before and after you bring them in for a walk and make sure they don't have any parasites on them. Especially large breed dogs, prevention is when you take them out for a run or a walk, you make sure you choose a service where it's safer for them. They don't go into uneven areas or anything because if they get injured themselves and everything, which is very common in labs or large breed working breeds.
Sure.
The other thing is environment at home, which is very common, and we see that a lot in our hospitals where pets get into foreign objects. If it's like baby proofing or pet proofing your house.
Yeah, exactly.
So you want to make sure you pick up everything. If you have a small breed dog, then you want to pick up everything from the floor, make sure they don't get into anything which they're not supposed to get in. And it's heartbreaking to see, and for some of those pets come in vomiting, and and we find out with diagnosis that they have a foreign body.
Oh my gosh.
Which they pick up. And I have a lot of stories to tell about that. And those foreign bodies sometimes can put people in problem. And also pets, of course, is a life-threatening thing for them. So doggy-proofing the house like you do for a child.
Okay.
So they don't get into anything. For large breed dogs, the same way. They can jump up on the counters, steal your food. They can get sickness with that, vomiting, diarrhea. They can get into chocolates. They can get into, people who smoke, cannabis or something. I've seen a lot of toxicity with dogs where they get into people's smoke and they come up with sickness of that too. So, doggy proofing your environment and keeping them safe, not only inside the house, outside the house. That's one aspect of prevention at home.
Okay.
Second is, of course, nutrition. Because we see them only once or twice a year, maybe a little longer, a few more times. But
sure,
they live in your house 24/7, and whatever you feed them, that translates into their health. Like us, when we go to our doctor, they tell you this is right, this is wrong, and everything. Same thing with pets. And I think nutrition and preventative care in that aspect is very close to my heart. And I take that very seriously, what you feed to your dog and how to prevent it. So nutrition, weight control is also a huge thing because that can lead to many conditions, which we'll be talking about in our fourth episode with cats, especially dealing with that. So these are the two things come in mind. But if you have any specific question relating to preventative care at home, I'd be happy to answer those ones.
Oh, yes. Well, I mean, nutrition, I understand completely. I mean, I have 2 golden retrievers myself. And of course, given the opportunity, they'd eat anything and everything.
Correct.
And I mean, we probably look after their diet better than our own diets.
Good to hear.
They because we're responsible for their health.
Right.
So it is something I hold dear to, and we want to try to make sure that they maintain a healthy weight. Is it easy to ensure that, or to check on the dog's weight or your cat's weight at home? Make sure you're not overfeeding it, or he or she is not getting obese.
Right. Yeah, that's an excellent question. So that comes to checking your pet, not daily or maybe a few times a week. I mean, if you're with a pet, they're lying in the bed with you or on the couch, or you're walking them, so you're constantly with them. But sometimes if you don't touch them and feel everything, so we call it, at a vet clinic, we do body scoring for a pet. So you run your hand from top of the body to shoulders and all the way through. And you can learn that by asking your vet to provide you that information, how to do a body score on your golden retriever. So, and is different for different breeds. Small breeds and certain breeds, they have a different body score. But so the scale can be 1 to 7 or 1 to 9, and you have to be kind of in the middle. Okay. And so, that's the way you can tell. Also, you look at the hair coat, make sure you're giving them a good nutrition and everything. And I want to, in the future, I want to do an episode just on nutrition, just on weight, the feeding and everything, because such a huge topic for people. And there's a lot of misnomers and there are myths about what to feed. Is pet food is bad and the natural food is good. There's a lot of controversy around that. But I'll tell you my perspective as a professional, and what's good and what cannot not be good for your pet.
Right. I think that would be a very valuable episode to learn from. I look forward to that. Right. For one of the things for keeping your pet safe at home, you mentioned avoiding hazards and stuff. Would training play a part in that? You want to bond with your dog. So things like I know sometimes your pets will get destructive as a form of separation anxiety.
Right.
They'll eat something that they shouldn't. Or, you mentioned they're counter surfing and that. Would you consider, training with your dog and deterring certain bad behaviors part of that preventative care?
Yes, absolutely. Especially in dogs, dog training is a must. You have to spend some time and effort, either learn yourself how to train for basic commands.
Of course.
Come, sit, stay, on a walking, on a leash and everything. But there are a lot of facilities available outside resources you can get. And that time and effort be well worth it, because unfortunately, that's such a good question you ask me, because most of the pets, young dogs, they've been euthanized or given away to the SPCA if due to behavior.
Yes.
Chewing, separation anxiety when the owner is away, they destroy the house, or, So I'm a huge fan of having dog training done. If you have time, you can put some time and effort into it. You can learn yourself, and then you can apply those things. Because everybody has a different bond with their pets and the way they want to be trained and what they want their dogs do. I mean,
Of course.
some people want to do all the tricks in the world, but some people say, okay, I just want to take it out for a walk, make sure they walk on the leash nicely, they don't pull me. I control them, it's safe for them, they're not pulling themselves or lunging at the other dogs.
Right. Yeah.
Yeah, so I think absolutely. So that's the dog training part, and that's almost a must, because especially if you're going to be walking them in the large breed dog, especially with your golden retrievers.
No arguments here. When I
Yeah.
walk them both, that's 150 pounds of fur going whichever direction it wants if they're not trained.
Right. And also the other thing for puppies is house training. Which your vets talk a little bit about it, but everybody has different ideas. And house training means what are the timings to go out, how often to take them out, and people are really have mixed things on that. And what you want to do is the general guideline is that when you wake up first in the morning, like yourself, you want to go to the bathroom.
Yeah.
The same thing. Take a leash, take your pet out, or if you have a fenced-in backyard, open the door, let them go out. They need to relieve themselves because they're holding the bladder all night.
Yeah.
So then you bring them back, and you probably want to feed. It depends what feeding schedule you have for them, and we can go over that. You want to feed them, wait 10, 20 minutes, and then you want to take them out again, because as soon as they eat, within the next 15, 20 minutes, they have that, we call it a gastrocolic reflex. Anytime the food goes in the stomach, they have to evacuate themselves.
Oh, okay.
So that's the clue you want to get. So you want to take them out. People wonder, why they have accident in the house, because you haven't catch on the clues. So and then you take them out, bring them back, and then they can be in the house. So especially when the pets are younger than 1 year of age or puppy stage, you want to take them out more frequently to make sure their bladder is small, they're developing that, the tone is not there, so they can't hold much.
Right.
So they will have accidents. So don't scold the pet because they have no control. It's not their fault. You have to take them out more frequently.
Of course.
So, yeah.
Yeah, it does sound like establishing a set routine is
Absolutely.
another element of preventive care for your pets.
Absolutely. And I can tell you with my personal experience with our pet Xena, and over the years, we have a lot of pets, and we set a routine, and we have no issues. I think issues happen sometimes created by us as pet owners. But if we stick with the regime and say, okay, they're going to get 2 meals a day, that time and that, few hours up and down is okay, but they're expecting a meal like you looking for your breakfast. And they're expecting a dinner like the way you're going to have dinner at that time. So I encourage people, when you sit down, you feed them. 2 meals, the jury is still out, which is right and all that. But I think for an average person who's busy, lifestyle and everything, 2 meals a day works well for people. So a breakfast and a dinner. And never leave the food out there for them to graze on all day. It doesn't work that way. Again, like I said, if they're grazing all day throughout the day, there's no timing of house training you can be able to do, because every time they eat, they have to probably go. So you will have accident in the house while you're working or you're out, correct?
Right.
Yeah. So feeding a breakfast and also measuring the food is also important. And that goes along with my topic when I'll be discussing on nutrition, and then we can go over that detail. But that schedule is such a critical thing for house training purposes and not having accidents, and which you think they can soil the house and everything.
Right. And I would think that routine, and we'll talk about recognizing illnesses in our pets in another episode, but having that routine also lets you see when something is out of the ordinary, and you can recognize that maybe that's the sign of an illness.
Correct.
Okay.
Yeah. So if pets eat, you take them out, they have a normal bowel movement, they have solid, they have a certain pattern, you will know because you're living with them, and that's normal. You take it out for 10-minute walk, they have to stop 2 places to go to the bathroom, and that's a routine. But you're right. But you should also look at what the stool is like, whether it's soft, solid, how often they go. And that's also a preventative measure because you can pick up on the illness quicker if they have a softer stool, the
Right.
color is not right, or if they go more frequently or straining to go, then there's some other issue with it.
That's great. Thank you so much for that information. Is there anything else you'd like to impart about preventive care, whether it's in the home or it's something that people should be talking to their vets about?
Yes, and preventative care. So, beside vaccine, heartworm testing, heartworm prevention. So that's the medical part of it, and also not only that, but also preventative care depends on the life stage of the pet.
Okay.
When the pet is middle-aged, older, you also have to, for dogs, maybe start to look at the brushing their teeth if you have the time for it, or at least to give them some kind of dentist sticks or something like that, which they can chew on, or feed a diet which can help their teeth as a preventative. That's also a preventative measure. Keeping the weight optimal. But if anything comes up which I missed in the preventative care and haven't focused, you can point out or we can address in our next episode. But so that's the medical aspect of the preventative care with your vet at home, all the basic stuff. But then there's surgical preventative care.
Surgical, okay.
And that's having your